All right, welcome everybody. We've got a good group here. I'd like to introduce Dr. Jake Young. He's a doctor of physical therapy and managing partner at Renew Physical Therapy Auburn. He's very passionate and very knowledgeable about dry needling. So I'm going to turn it over to Jake to share his knowledge with us.
Hello, everyone. As Kate said, my name is Jake. I've been a physical therapist for almost 9 years. And of those 9 years, I've been needling for almost 4 years now. So in the beginning, we're going to kind of just give a vague understanding and description of what dry needling is, what it entails. I promise you it sounds a lot scarier than what it truly is. And then we'll kind of get down into more of the athletic role of it and what it can play in athletic performance outcomes and just kind of overall healing from athletic events. So initially, dry needling is a technique that we use as trained physical therapists. We use a thin monofilament needle. At the end of the day, what does that mean? It basically is just a thin needle. It's smaller than a follicle hair, and it's very relatively pain-free when we do it. It is used for trigger point and pain relief in muscles. That is the very superficial way that we use it. We also use it for neural regulation, as far as getting the nerve to fire a muscle. We can use it down a nerve to help that nerve activate certain physiological processes within the body as well. So how it works, it reduces muscle tension. That's probably most of the time what I specifically use it for. There are some different techniques out there. And so by reducing physical stress and causing a little bit of muscle fatigue, we can promote relaxation and thus pain relief. It promotes circulation, which in the good thing, in the beginning, we can get some local inflammation, which can be a good thing in a small manner, and increased blood flow that allows good enzymes to be brought into the tissue and thus, again, healing and pain relief. And then also normalize those physiological processes like I had just talked about. Now, this can be in acute injuries or chronic injuries, just kind of depending on how a patient or person presents. Now, the big question I always get is this acupuncture? Dry needling is not acupuncture. And you can kind of read some of those on the screen of what the differences between the two are. The only similarity that we see between the two is actually the needle that we use. We do use an acupuncture needle. They follow more of like a chi or meridian technique. They tend to not go as deep as we do. We're looking for the deeper muscle fibers majority of the time. Now, with that being said, we do have techniques where we do kind of follow those energy patterns or maybe nerve distributions to get activation within certain tissue. But a lot of the time, we're looking for a response and we're going a lot deeper. Okay, so integrated dry needling, that is basically kind of the big dry needling techniques that we use. It's the most advanced as far as training. And so it combines a lot of different models into one technical approach, like I was talking about, whether it be the chi patterns or the soft tissue patterns. They're both peripheral and central principles. And so peripheral is more of kind of into the arms, into the legs. Central would be more of like spine, neck, low back. It does not have limitations of the trigger point paradigm. And that just basically means that a trigger point itself, you have to treat the trigger point to get relief, or you have to have a response to get relief. Research has shown that treating outside of that can provide a lot of relief as well. A systemic view of the musculoskeletal dysfunction. So that describes the fact that we treat you as a whole. Just because you maybe have shoulder pain doesn't necessarily mean that we'll be treating your shoulder, as it could be coming from your neck or, down the arm. Same thing with the elbow or the wrist. Maybe we'll be treating your neck or your shoulder to really get after the root cause of the issue and not just where the pain is located at. And then the quantitative analysis of efficacy of treatment, fancy term of just saying that a lot of research has been done to show that dry needling and the integrated dry needling techniques have been very effective. So needle location, when we kind of go into the body, we look at three different patterns. Systemic, which is that each nerve innervates a muscle. That tissue corresponds to a specific spinal segment within the body. And so what that means is that, again, we can get after that nerve or that bundle at a peripheral level or in the arms or the legs by activating certain muscles. Sorry, that was segmental I was referring to. I apologize for that. Symptomatic, that is just isolating purely where your symptoms are located at. So again, if you have shoulder pain right in the front, maybe we're going to go in the front of the shoulder and treat that muscle because that's where we feel that shoulder pain is coming from. And then lastly, systemic, and that's more of that neurologic, circulatory, physiologic technique. And they're hard to separate. And so we generally treat them as a whole with the homeostatic points that we'll talk about coming up soon. A lot of those homeostatic points are correlated to a specific trigger point that has been researched within the body. And so here is your specific trigger points. I know they're kind of hard to see, but you can see there's quite a few. They kind of go up and down. So this is the back side of the body. And here we have the thoracic, lumbar, sacral segments and how they correlate down in the body. Same thing here as we go into the front. So then we also have three different types of trigger points. We look at systemic, and that is treating a specific symptom or pain. Again, is that trigger point being caused by your bicep? Necessarily, that doesn't really follow a trigger point pattern or a nerve pattern, but it's enough that we can provide you relief. Paravertebral, that's more of treating these vertebral lines that you can see across here. So, here you have your specific thoracic vertebral lines. Here you'll have more of your lumbar. And by treating those, we can activate the nerve root at the spinal segment to get that to calm down. And then lastly, homeostatic, which is a specific trigger point that we had found to be, again, specific to a nerve. Here's just a couple of those specific trigger points. So you can see, like here we have one in the supraorbital. Here we have one in the inferior gluteal. And those can very commonly cause nerve-related symptoms down into the leg or into the head that gives similar like headache symptoms, or in the leg be, what you commonly would get diagnosed as sciatica, but it's all related to that nerve or that trigger point. Okay, so just kind of some safety things. So one of the risks that we do have with it, if we're treating the neck or kind of the upper trap area, is what's called a pneumothorax. And that's when you can technically put the needle through the through the lung and pierce the lung. Now, these things are very, very rare. We have safety techniques that we take, whether it be that we lift the muscle off the body, or we only use a specific size of needle to make sure that we're not going specifically deep, or that we use a bone as our backdrop. So we know that we're going to hit the bone before we do any sort of damage. Now, hitting the bone probably sounds scary to some, but you do not feel it when that happens. 99% of patients that I treat never even notice that I've hit the bone if I do use that certain technique. Also have to be careful of our kidneys. Those are located between spinal segments T12 and L3, so kind of your upper low back. And technically what we do is we, as physical therapists or doctors of physical therapy, we have skilled palpation skills where we know where we are in the spine, and we generally stay away from there. Or we have, if we do feel like the symptoms are coming from there, we will move the tissue away and use a shorter needle so we don't have any chance of hitting any sort of those structures. Now the 1-to-1, the 2-to-2 rule, those are specific rules that we use within the spine that can correlate to into the kidneys or up in the upper traps if we're worried about potentially interfering with the lung field. Now, the 1-to-1 rule is that we use in the thoracic spine, we use a 1-inch needle and 1 finger width away from the spinous process. And the spinous process is that little bone that you feel in your spine. And so we know that if we stay within that and we only use a 1-inch needle, that we are safe. Research has shown that time and time again, and we will not interfere with the lung field. The 2-to-2, same thing. That's the technique that we use in the lumbar spine. Syncope, which is the medical term for passing out, that is a precaution that we do take. I have had patients become sweaty or feel nauseous, but it quickly goes away. I've never had anyone who was going to pass out. And a lot of times what that is that's a nervous system reaction. And majority of the time, people have just worked themselves up so much because they're so nervous about what it's like that after they get it done, it never happens more than once. Anticoagulants or blood thinners, obviously, right? We're sticking you with a small needle. There's a chance you could bleed and bruise. That really just kind of is more of an education piece for my patients. And what I use that for is to let them know, hey, you might bruise a little bit more. You might have a little bit more soreness after we do it, but generally it does not prevent us from performing the technique in any way. And then with pregnancy, this is something that obviously as therapists, we take seriously, but research has shown that there has been no adverse reactions to pregnancy. It is something that we do technically kind of educate the patient very heavily on. And a lot of times I personally won't do it in the first trimester if it's in the spine or close to the abdominal cavity, just because that's a higher risk to lose pregnancies in the first trimester. And so I generally try to stay away from it unless the patient is very adamant about it. So some myths about dry needling. Dry needling hurts. It doesn't necessarily hurt. I've had a lot of patients say it feels weird, or I've had a lot of patients say it feels different, but majority of the time, what it feels like is just an increase in pressure. So I had a patient describe it to me one time as it felt like an elephant was standing on a pencil. But while the needle is in, 3-8 seconds, but quickly after it's removed, you do not feel any symptoms. So only trained physical therapists can perform dry needling, not all physical therapists. It is something that we do have to get trained in outside of our doctorate degree, and it is something that is an extensive education that we have to do. And then again, like we had spoke about, dry needling and acupuncture being the same, they are not. They are 2 totally different techniques. The only thing that's similar about it is the needle that we're using. Now, the benefits of it is that it has shown to accelerate healing, improve flexibility by, again, allowing increase in blood flow into that area, promoting muscle relaxation, allowing activation of the nerve. So then you're able to use the muscle as a whole, not just a small portion of it because of the trigger point or tightness. Increase circulation, thus promoting the previous 2 as well. Pain management and relief, that's what we use it for a lot, allowing you to get out of pain, to promote the appropriate exercises to make sure that your pain doesn't come back. Reducing inflammation. Now, I know we had talked about bringing a little bit of local inflammation into the area with some of our techniques, but by bringing in more inflammation, it actually allows the process of healing to continue. And so that's how we'll thus reduce the inflammation. Tissue restoration. And how we're going to use that is the same exact techniques, right? Decreasing tightness, improving blood flow, thus improving health. And then again, improved athletic physical performance with all those similar techniques. Conditions treated by dry needling. So this is a head to toe treatment. This is something that we can treat headaches, we can treat temporalis in the side of your head, and we can treat all the way down to the muscles in between your toes. Just depends on the conditions you come in with, the symptoms your body presents with, and what we had found, whether it be referral pain patterns or trigger points to help with those techniques. Okay, so some specifics about use in athletics. So the big thing that I really use it for is I generally use it post competition. I do have a lot of athletes that come in that they ask to be done before, a lot of triathletes, a lot of marathon runners who are familiar with it. Um, Mountain bike racers, I have a few of those where they'll come in and do it before. And what we're using that for is that neural input and that muscle activation, but also decreasing any tightness that they may have had related to training or related to past injuries. And we have seen a huge increase in range of motion and output as it comes to during competition times. My post competition athletes, obviously, they're coming in, whether it be related to pain and tightness from what they did, or just kind of their nervous system being too heightened. So we have to down regulate that a little bit by activating specific tissue. But at the end of the day, our goal are always to improve outcomes and results, whether it any sort of competition or performance that they're in. I do get a lot of CrossFit athletes as well, a lot of shoulder pain that, they'll come in several weeks before, and I'll see them 5, 6, 7 times before a competition or before a meet, just to continue to progress range of motion and strength as well. And then here's just a couple pictures of what the needling looks like. So you can see that, those needles that are in the top left picture's neck, those are not very deep, but they do look like they're going very deep. But again, a head to toe kind of technique that we can use. Here's just a couple pictures of our trained therapists that are performing those on patients. And you can see even the muscles within the face that we can do. These are all our Renew locations that dry needle. So in this area, we have Auburn, Bay City East and West, and then State Street in Saginaw and Midland. And then there's some down south in the Frankenmuth area, and then clinics up north in Tawas that do it as well. And then obviously with this, we won't be having a demonstration. And then Kate, is there any questions?
We did have a couple questions. This one, we have a group joining us from the Bay Aranac ISD, so thank you guys for listening in with us. They asked, how receptive are patients to treatment, and have you ever had any patients decline just because they were too afraid of the needle?
Yes, I would say probably 80 to 85% of patients are very intrigued and very inquisitive about it. And then there's about 15% of patients where they either decline right off the bat, or I'll try it once or twice and they don't like how it feels and they don't want to do it again. And usually what I tell patients is either way, therapy is going to help if that's what their condition entails, but needling gets you there faster. So usually somewhere in the neighborhood of about 4 to 6 sessions, we can get you faster with the needling versus with a lot of our other techniques that we use. But either way, you get better, you feel better. The needling is our first line of defense to get you out of pain quickly.
Awesome. Another question is dry needling covered by most insurances? And if not, what is the approximate financial commitment per session?
Okay, so yeah, so needling is not covered by any insurances that you would come in to see therapy for. But we do offer a cash-based service, which it's $50 a session for 15 minutes. And most people, once they get involved and they do it, they spend a lot of money because they realize the benefits of it. Now, with that being said, I can't speak for every clinician that dry needles, but myself, if you are coming in under for a impairment or for pain or for performance, and you're being seen for physical therapy, a lot of times we include it into our treatment. And then patients generally will come back and pay out of pocket for it because it is something that they find to be very beneficial.
That's great. And just for everybody that's here, we do still have time for more questions. So if you do want to submit any last minute ones, please feel to do so. You touched on this a little bit, but I still want to ask it as a question. On average, how many sessions need to be completed to see benefits? And are the benefits generally felt immediately, or does it take some time?
And it can be. Every condition, every impairment is different. I do have a lot of patients who do feel better, but I can say I probably have an equal number of patients that are a little bit more sore when they leave. I will say on average, it's probably in the neighborhood of about 3 to 4 sessions before you notice a difference. Now, with that being said, that doesn't mean that your pain or your impairments are completely gone, but you do notice whether or not it's beneficial. That's usually what I recommend to patients is give me at least 3 to 4 sessions with the needle if they want to do it before we say whether or not it's helping.
Awesome. I don't see any last minute questions coming in unless somebody wants to sneak one in there. I will mention that everybody who registered for this webinar will receive a follow-up email. It'll have Jake's contact information and where to find him. And I'll also include the recorded version. So anybody who wants to rewatch it or anybody that wasn't able to join us live can access it. So other than that, thank you everybody for joining us, and thank you, Jake, for presenting. That was very interesting.
Yes,
And
thank you guys.
informative.
Appreciate your time.
Thank you.